Can you handle the pressure on your ears? For most of my life, I couldn't. Growing up, I got so many ear infections, so many earaches, and I was absolutely petrified to put my head under the water because I was afraid of getting more ear infections. My ears always hurt. I wouldn't even get them wet when I was having a bath or a shower. Surprisingly, I'm not the only mermaid to have this problem or the only person. A study was done recently, last year, out of Montreal, and it found that the #1 issue facing professional mermaids in all of the potential health and safety issues was massive ear infections, chronic ear infections, happening all the time. Ear infections can happen for a few reasons. They can happen because of the water quality. They can happen because maybe you're having a drainage issue. Sometimes they can just happen because your ears get cold. It's crazy. And pressure plays a big role in the pain that mermaids experience. Just like freedivers, just like scuba divers. And we have to start trusting these amazing people who came before us because they have come up with so many solutions. So for me, when I'm doing pool gigs and I don't need to go very deep, I like to use earplugs. It just keeps the water out. I don't have to worry about it. These are the kind I like to use. I've done videos about them before. The Vancouver mermaid, Courtney, has done an awesome video about them as well. Everybody loves them. They're great. They're just a little piece of clear silicone putty. You break it apart like Play-Doh, stick it in your ears, you are good to go. In fact, even if you don't have ear problems, if you're going to be in the pool constantly, it's a good practice to do. That way you can prevent yourself from getting ear infections in the long run, especially if you're going to be doing this for a long time. Now, pressure. Equalizing your ears is hard. When you train to be a freediver or a scuba diver, they spend whole lessons trying to help you learn to equalize your ears. And for those of us who have chronic ear problems, it can be even harder. My entire life I've struggled with equalizing my ears. I've only recently been able to equalize my ears when I've gone on airplanes. So I did 2 things. 1, I took a freediving course. I made it very clear to my instructors that I was having problems with my ears, so they gave me some tips. One of those tips was to equalize right away. As soon as I put my head under the water, start equalizing. Don't wait until you dive all the way down and start feeling the pain. You can equalize by putting your hand on your nose, like this, and just pushing a little puff of air through it. You hear that little click in your ears? You've equalized. There are lots of other techniques you can actually learn on Facebook and YouTube. Adam the Freediver is amazing. Look him up because he has like 4 videos about equalizing your ears and he gets into the science of it. Now, equalizing my ears at the circus was okay. I tried to do it without earplugs. I was a little scared of infections, but I did it. As I got deeper and deeper and started getting close to that 20 feet deep mark and further, nothing happened. I really could not get them to equalize. And I was under there doing this with my jaw, trying to make them pop, and I just couldn't get to work. So I asked my freedivers if they had any other tips, and they did. This is a really cool product. It's called Otavent. You can find it on Amazon, and it is to help you pop your ears and to help you train. Comes in this nice little convenient carrier, and basically, you see it's this little white piece that looks like a whistle, and on the end you put a balloon. It comes with a bunch of extra balloons. I'm not very good at this yet, and it's pretty funny looking to see, but basically what you want to do is put the hole to your nostril, plug your other, blow through it, and the goal is to gradually blow the balloon up more and more and more. What this does is open your eustachian tubes, the tubes in your ear that allow you to depressurize. It trains them. And some people's tubes are really, really, really tiny. In fact, I had to have surgery multiple times because mine are so tiny. We are talking super tiny. So strengthening that reflex and that muscle can be tricky. Let's see how I do. I'm not very good. That's about as far as I can go. But when I did that, I could feel it, just a little. And the idea is you do it a few times a day, and before you know it, you've actually learned how to equalize your ears. It's really good. I've used this as well. When I come out of the water, if I have issues and I can't get my ears to equalize, I'll actually sit down and use this a little bit, and all of a sudden my ears pop. I'm in Canada and it cost me about 15 bucks for this thing, so it probably cost you about 10 or 11 bucks in the States. Other options I've talked about in other videos, so I'm not gonna get too crazy about them right now, are ear drops. They're good for clearing out your ears. There's specific ones for swimmer's ear. But one thing I never really mentioned before, because I only recently had this experience, is it's okay to talk to your doctor or even an ENT if appropriate. I went to see my doctor and I told her all of these problems I was having. Well, guess what? They're not because of my ears. Yes, my eustachian tubes are very small, but they're still functioning. The problem for me is actually my sinuses. It turns out I have these things called turbinates, which we actually all have in our nose. They're supposed to be really small. They're way up here and they protect your nose. They're kind of like the wall that keeps all the pathogens and allergens and things like that out. Well, mine are giant. They are so giant that they're actually blocking the amount of air and the flow and changing the pressure of how that air moves through my nose. Yeah, not great. So I'm doing a treatment. There's two options. You can have a surgery or you can do a steroid treatment, a localized steroid treatment. So I just have a little nasal spray that I've been using every day. It'll take longer than surgery, but it has far less risks. And I've actually noticed a magnificent difference. I can now swim in the pool and equalize with ease. It's a little bit difficult when I get deeper, but I can still do it. So between practicing and addressing the issues with my nose, and then doing appropriate follow-up care by using ear drops and things like that, I've actually started being able to equalize and less pressure, no more ear infections, no jaw pain. So please, don't be afraid to talk to your doctors about it. You'd be surprised. I mean, they are experts in it after all, and you don't have to tell them it's mermaiding if you're worried they're gonna give you a weird look and be like, please don't drown. Just tell them you have trouble equalizing your ears when you swim, when you're on planes. You don't have to get into everything. Of course, you could be like me and tell your doctor everything and get her to bring her kids to come see you at gigs. It's pretty awesome. Anyway, that's been the latest episode of Raina's Resources. If you have things that you would like to know, please let me know in the comments. I'm working with all kinds of different experts around the world, so you're not just getting my knowledge. The knowledge that you heard from me today came from a doctor, came from freedivers. This is how I learned it, and I'm sharing that with you. So hit me up. If I don't know the answer, I will find it out for you. Please like and subscribe, hit that notification button, check out my Instagram and my Twitter and my Facebook. Best wishes!